Now for some health news. The Ministry of Health, under the leadership of newly appointed Minister Dr. Frank Anthony, will be seeking to expand Guyana's testing capacity for COVID-19 as there is the need for widespread testing for the virus to ascertain the actual situation locally. Here's that report.
In expanding testing, some immediate actions are to be considered. Firstly, Minister Anthony said that the new government has already sought to address the issue of limited testing kits. This will eventually allow for a decentralized approach to having COVID-19 tests done. This means the ministry will have to build capacity for testing.
Why we need to decentralize is that it takes sometimes 8 days for somebody who tested positive or who had a swab done in Region 9 for that swab to get to Georgetown, then be tested at the reference lab, and the results get back to them. So if that person is positive and you have a turnaround time of 9 days or 8 days or whatever it is, that's too long because that person would have walked around and be in contact with a lot more people and infect them.
As part of the government's new approach to revamping the country's response to COVID-19, there is also the goal to have 500 test samples processed daily. The public health sector has the capacity to process 300 COVID-19 tests daily.
We want to collaborate. We've already engaged the private sector because they have PCR machines in their hospitals and so forth to get them to be involved in this effort. And we are hopeful that we can get the private sector to increase their capacity to about 200. So as a country, we'll have at least 500 tests per day that can be done.
It was noted that the country's current testing capacity in the health sector is at the level of the National Public Health Reference Laboratory. There is also a consideration for another method of testing to be used. For InfoHub, DELICIA HAYNES.